hyperviscosity-related retinopathy in Waldenström microbulinemia. I studied Catholic University Nursing School, San Vincent of Paul. My name is Jocelyn Cedeño and my teacher is Master Yamamoto. Definition. Waldenström macrobulinemia is a lymphoproliferate B-cell disorder characterized by overproduction of monosomal IgM1 and is the most frequent diagnosis in patients with hyperviscosity syndrome caused by paraproteinemia.
Some remarkable things have happened in Waldenström's macroglobulinemia in the last 2 to 3 years that have truly changed the way we look at this disease. You know, it had been described for almost 70 years, and yet we didn't know what the genetic basis of the disease was. And this was really the reason why we couldn't move forward and develop novel therapies for patients with Waldenström's macroglobulinemia. So we had to rely on what's called hand-me-down therapies, you know, things that we waited for our colleagues in the lymphoma world, myeloma world, to be able to vet out and ultimately, you know, get our hands on these things. So 3 years ago, we reported the discovery of mutation in the MYD88 gene. This is, was a pivotal moment for our field, since over 90% of the patients with Waldenström's actually expressed this mutation. And then subsequent work by us and others ultimately helped identify the important signaling pathway that's triggered by this mutation. Then came also the discovery of the CXCR4 mutation, which is present in about a third of patients with Waldenström's, and this gave us further insight into the disease. And you know, the important outcome of these two discoveries has been the development of the drug ibrutinib. It was very quickly recognized by work that was done in our laboratory that MYD88 triggered, Bruton's tyrosine kinase, BTK. And this is, of course, the target for ibrutinib. And in a short time frame, we were able to translate this into a clinical trial, which received breakthrough status by the FDA, and as you probably know, just recently received FDA approval for the use of ibrutinib in patients with Waldenström's. And this was based on that scientific discovery.
Application in nursing. Symptoms to HBS can be categorized into general symptoms, such as tiredness, fatigue, weight loss, and anorexia. Neurologic symptoms such as headache, nausea, vertigo, dizziness, ataxia, paresthesia, decreased hearing, and really cough.
Waldenström's macroglobulinemia is a disease with two significant issues. In the bone marrow, or sometimes in the spleen and lymph nodes of patients, there is a lymphoplasmacytic lymphoma or lymphoplasmacytic infiltrate. But there also is a second issue, and the second issue is a high serum level of IgM, a monoclonal protein of IgM antibody variety. And the issue related to the IgM is often what impacts patients substantially. This big protein causes the blood to be more viscous or thick compared to normal. That can cause a lot of sludging and lack of delivery of oxygen to various parts of the body, the fingertips, the brain, even the eyes, causing kind of organ dysfunction.
Pros and cons. The diagnosis of HBS is confirmed by measurement of elevated serum viscosity in a patient with characteristic clinical manifestation of HBS. No exact diagnostic cutoff exists for serum viscosity. However, as different patients will all have symptoms at different values, plasmapheresis studies have investigated LCA in patients with WM to determine the threshold level of viscosity at which symptoms or clinical findings might occur. Although at no weighting is necessary that the LC at which symptoms occur varied among patients. No patient was found to have exhibited symptoms and LC of EOS of less than 4 cc.
Waldenstrom's macroglobulinemia is a disease with two significant issues. In the bone marrow, or sometimes in the spleen and lymph nodes of patients, there is a lymphoplasmacytic lymphoma or lymphoplasmacytic infiltrate. But there also is a second issue, and the second issue is a high serum level of IgM, a monoclonal protein of IgM antibody variety. And the issue related to the IgM is often what impacts patients substantially. This big protein causes the blood to be more viscous or thick compared to normal. That can cause a lot of sludging and lack of delivery of oxygen to various parts of the body, the fingertips, the brain, even the eyes, causing kind of organ dysfunction.
I'm Thomas Baldrick at ASH 2014, joined now by Dr. Alessandra Tedeschi. She's from Italy. Thank you for stopping by and spending some time with us.
Thank you.
Let's talk about this retrospective study for which you're presenting data.
Well, this is a study we conducted as in ESMO and CCN guidelines. Bendamustine is considered a suitable treatment for Waldenström macrobulinemia, but there are not so many data in literature. There is only one study for frontline patients, and there were 21 patients treated with this combination, and another study from Professor Trion of Dana-Farber with just 28 patients enrolled. So we made this retrospective study to validate this combination treatment in Waldenström disease, and to see the toxic profile of the combination as salvage treatment. Furin analogs are very effective, but maybe there are a lot of late toxic effects like secondary leukemias or myelodysplastic syndrome transformations. And it seems that bendamustine doesn't give these late toxicities, so maybe we have to follow further our patients. Maybe this can be a next study of late toxicity of bendamustine in these patients, but till now we didn't find any important issue with this drug.
Thank you, Doctor. We appreciate you sharing your information with us.
Thank you.
Conclusion. Retinal manifestation of hyperviscosity syndrome occurs at lower serum IgM and Sp levels than previously reported. Indirect ophthalmoscopy with scleral depression along with retinal basal diameter measurement are able to detect the earliest hyperviscosity. Syndrome-related complications are shown to be considered in the treatment of patients with WM.
Waldenström's macroglobulinemia is in part named for the Swedish scientist Jan Gustav Waldenström, who identified the disease in the 1940s. The term macroglobulinemia comes from the characteristics of the protein molecule where the cancer is found. Waldenström's macroglobulinemia, WM for short, is a type of non-Hodgkin's lymphoma that involves the B-cell antibody known as immunoglobulin M, IgM. IgMs are the largest antibody protein molecule in the body and is consequently known as a macroglobulin. Waldenstrom's originates in the bone marrow and most typically affects the blood, but it is also found throughout the lymph system and therefore can affect various organs and lymph nodes. This disease is a slow-growing and rare cancer that typically affects older people, half of which are over the age of 60. With Waldenstrom's, some of the IgM molecules become cancerous and clone abnormally. Normal cell death is not programmed properly in these cells, and as they multiply, they clog the blood, making it thick. The thickening of the blood is known as hyperviscosity. Symptoms of the disease can include nosebleeds, night sweats, fatigue, dizziness, headaches, blurred vision, numbness in the extremities, or an enlarged liver, spleen, or lymph nodes. Until the 1990s, little was known about the disease, and there was little progress in treatment options. But from the 1990s on, rapid advances in medical science have greatly changed what we know about the disease, as well as treatment options that have dramatically improved patient outcomes.